Hey, it's me, Allison, your crunchy gut health mama, and I'm going to be talking about breast implants versus fat transfers versus a breast lift and telling you why I made this decision that I did with my own surgery. You're listening to What the Gut, a functional medicine and holistic health podcast for busy women who are ready to take charge of their health without the overwhelm. I'm Allison, your host, a double board certified family nurse practitioner specializing in functional medicine, here to help you decode the gut hormone connection and finally get the answers that you've been searching for. In this space, we're cutting through the confusion and diving deep into holistic wellness, because feeling your best is not just about another diet or quick fix. It's about understanding your body, healing from the inside out, and making sustainable changes that fit into your real busy life. From gut health to energy struggles, hormonal imbalances to sustainable weight loss, I'm bringing you practical strategies, expert insight, and real talk that will help you thrive, not just survive. So if you're ready to finally feel good in your body again, hit that subscribe button and let's do this together. Quick reminder, this podcast is for educational and empowering purposes only, and it is not intended as medical advice. Be sure to consult with your personal healthcare provider for personal recommendations. Welcome to What the Gut, where we take control of our health one episode at a time. First, I want to talk about breast implant. Whenever I went to my surgeon, I had a list of questions, of course, that I wanted to ask. And surgery is not my specialty. Even if I'm a nurse practitioner, that does not mean I know everything about medicine or in the healthcare field. I'm very specialized in functional medicine and also have a background with cardiovascular stuff as a nurse. So surgery is just not my forte. Therefore, I don't know all the ins and outs. And that's totally fine because the surgeons do, and that's what they're there for. So where I come from, a functional medicine background, I do hear a lot about breast implant illness. And so that is something that I know of and I know about, but obviously have never personally experienced. But I really wanted to make an informed decision whenever I was having surgery. And so I asked my surgeon the pros and cons of breast implant and just all about that, so that if I said no to implant, I confidently could say no and knew that that was the decision I wanted to make. So when it comes to breast implant, I've heard, okay, you can have them for 10 years and then you have to get them replaced, or breast implant illness, all these things. So I'm here to clear all of that up. This is what I've gathered. And I did my own research. And also I talked to 2 different surgeons about this. I shopped around. I did not go to the first surgeon that I originally had a consult with. Find somebody who works for you and fits your personality and somebody that you want to be working on you. I'll say that. It's okay to not go with one provider. But okay, breast implant. They are a product, and because they are a product and manufactured somewhere, they have to have a warranty. That warranty is 10 years. So that's why you always hear, oh, after 10 years, I have to have my breast implants replaced. You don't necessarily have to have them replaced at 10 years. It's really case specific, but 10 years, because it's a product, they have to put a warranty on it. So that's just following protocol. So that makes sense to me. So if you do have breast implant, you do have to be closely monitored. The surgeon that I decided to go with, if he gave me implants, he said with all of his implant patients, he would at least see them yearly just to check on them, make sure everything looks good, make sure there's no leaking or issues at all like that. At 10 years, especially, he reevaluates, and if they need to be replaced, sometimes they do. Most of the time, he said they don't. That kind of varies. It varies from case to case. Now, as far as breast implant illness goes, so my understanding is if you get breast implants, you could get breast implant illness, but this is very case specific. So if you are somebody who has a history of autoimmune disease, or even the genetic factors to predispose you to autoimmune disease, then you might get breast implant illness. And I say this because it's a trigger to your body. So it's a foreign object in your body. And even if you don't directly have issues right at first with it, later on you could. So a lot of times breast implant illness is seen a lot of times in women when they start going through menopause. So maybe they're predisposed to having autoimmune disease, and then they go through menopause, and then they have these breast implants, and their body reacts to that. So breast implant illness can also show up in so many different ways. There's so many different symptoms that you could have, and I'm not going to like dive into all of that. But for me, I'm somebody who autoimmune disease does run in my family, and I don't want to do anything that would lean me more down that road. So your genes only play part of the picture. If your genetics say you're prone to autoimmune disease, but it's really what you do with those genes that matter. For me, getting breast implants, that might take me on the road of having breast implant illness, or even like throwing me into having more autoimmune issues in the future. And that's just not something that's worth it to me. So I really appreciated the clarity that my doctor gave me on all of this. The first doctor I went to, he basically was like, oh no, we can put them in and you do your regular post-op follow-up and you're good. You never have to come back. And he had no concern or issue with following up. He said breast implant illness was like not a real thing. Yeah. So I encourage you to do your own research and don't just listen to your doctor. It's very important that you do, but also know where they were educated, know if they're doing their research and staying up to date on the most current research, but do your own research too, because even if it's their specialty, like sometimes they just are not up to date in the most up to date information. And that's just really important to do. So as far as implants go, I decided not to get them, and I'm really glad that I didn't. The biggest reason that I was even considering it was because I might want to be proportional. I have a large bottom, and my top is not as large, but I was concerned that with lifting my breast, maybe it would reduce the volume and make me look unproportional. And so I really wanted to make sure I was proportional. And so I was considering implants for that reason. But my health matters more to me than being proportional. So I decided to not go with implant. But I'm very thankful that I asked the questions I did and became educated on the pros and cons. Now, fat transfers. So many people are doing fat transfers these days. And if you have not heard of fat transfers, it's basically if you have liposuction done to your stomach, your thighs, other parts of your body, and then they put that fat in your breast. I heard about this and I was like, sign me up. That sounds great. That's natural. It's not a foreign object in my body. Like, what could go wrong, right? But as a nurse, I remember hearing in school, if you're a nurse, you'll understand, but there's like snippets of things you remember that you, like an answer to a test or something. And fat transfers and like clots are always something I connect the two with. And so I was like, why am I thinking this? Like fat transfers and fat clots. What's the deal here? Like I said, surgery is not my specialty. Here's the deal with fat transfers. And I did a lot of my own research. I talked to a few different providers about this too. So pros and cons with fat transfers. There are a lot of advantages. Okay. So one, it is your natural tissue. So it's not a foreign object. So that definitely reduces the risk of any kind of like issue you would have as far as like breast implant illness or capsular contraction or like leaking breast implants, anything like that. But also like you get liposuction in other places. So you can have the contouring of thinner thighs or a thinner belly or whatever at the same time. So it's kind of like a 2-for-1, right? But also a lot of people are actually like really satisfied with the results for this. Research shows that like 90% of people are very satisfied. So that's great. There's typically a lot less complications with fat transfers than breast implant. Also, like during surgery or post-surgery, like as far as infection or buildup of fluid or seroma or buildup of blood, like a hematoma, it's like less than 1%. So you don't really ever have to have like revision surgery for this. But there's also not been proven any increased risk in breast cancer with that. So that's great. There's not any evidence that shows increased risk of breast cancer or reoccurrence of breast cancer. And this is also stated by the American Society of Plastic Surgeons. So a lot of great benefits there, right? Why wouldn't you do that? Okay, here's the thing. So I was considering this and my doctor told me, you know what? Like the thing is, whenever you do just a breast lift, it's going to lift them. But that volume that a lot of us mamas, you know what I'm talking about, especially if you've been a breastfeeding mama, a lot of volume is not at the top of your breast. If you have implants or are younger and haven't had children, like you've got that great cleavage and you've got like volume at the top. That's what implants or like fat transfers will give you. It's not necessarily going to make your cup size bigger. It could, but like it's more for that volume in that upper quadrant of your breast. And so I was like, okay, sure, that sounds good. But these are the negative side effects of fat transfers. So there's actually an unpredictable amount of volume retention. Your surgeon can only ethically, legally, medically, like safely remove so much fat from your body. So if they're doing liposuction and getting that fat from somewhere else, they can't just take all of it. Like your body can only handle taking so much. So they can't take but that set amount. And then once they do inject that fat into your breast, or even some people want it put in their butt or wherever else, any other part of your body, only about 50 to 60% of that injected fat is actually what survives long term. So sometimes you actually have to have like multiple sessions of this to achieve like those long lasting results or the desired volume. For me, I wanted to knock all my surgeries out at once. I didn't want to be put back under. For me, detoxing from the anesthesia and like post-op antibiotics and pain pills was really important for me. I don't want that stuff in my system. I work too hard on my health and my gut to get it to where it is. Like, I don't want to have another surgery or repeat the same procedure just for a cosmetic look. But also, fat necrosis, oil cysts, and like palpable nodules are very common. And there are some common minor complications. They could require like further imaging and then biopsy. What do I mean by that? Okay. So say you have a fat transfer done and a few months later you are feeling on your breast and you feel a nodule. Okay, that's scary, right? Like we think breast cancer right away. For somebody who breast cancer runs in my family, and my family also has a history of like nodules in their breast, I don't want that, because if you do have a nodule in your breast, typical protocol from any medical perspective is to do a mammogram. In a mammogram, they cannot detect if it's cancer, if it's a cyst, if it's a piece of fat, like fat necrosis. They can't tell. They just see the nodule. So then you have to do a biopsy. Okay. From what I've heard, these lumpectomies and biopsies, like they're not really comfortable. Okay. And if you have multiple of those that show up over time because you had fat transfers multiple times to get the volume you want, that's just like more anesthesia and risk of infection and procedures on your body, and also a lot of anxiety. Think about it. If breast cancer runs in your family and then you're finding lumps like every few years or months or whatever, but it's really from the fat transfer that you had, like that's just unnecessary anxiety to me. So that was a big thing for me, but also the fact that like only about 50 to 60% of the fat they actually transferred would stay. Okay, so what are you really getting here? There's no way to really tell, but over time, it's really temporary. It's Botox or something. It's every few months you got to get it redone. But also radiologic changes. So fat grafting can actually cause these calcifications, like the fat necrosis or changes on mammograms. So like I said, when you see that, like you're going to have to get a biopsy of it. You can't tell on a mammogram if it's cancer, a cyst, or a piece of fat. That's just concerning to me. Now, also there's limited augmentation. So the achievable volume increase, it's really modest compared to implants. I will say I've seen some people who have had fat transfers and their breasts look great and it looks like they have implants. But remember, only about 50 to 60% of that is actually going to stay. And post-op, you can have swelling anywhere post-op for like up to 6 months to a year. So like that breast size at first, maybe like a month post-op, whenever they're like out and about doing their thing and they're all recovered, it's gonna go down. Like it's still swollen. It really just depends. Also, technique dependent outcomes. So results and complications, the rates of these are really dependable upon the surgeon and the surgical technique and experience. If you even decide to get this done, make sure this is from a provider who like does it all the time. But I will also say, like, just in general, fat transfer to the breast, it's a safer option than breast implant. So if you're seeking like modest augmentation with contour correction, then this is something that might be better for you. Then there's just the breast lift. Okay. So I just wanted my babies put back on the shelf. I decided, okay, I don't need all that extra fancy stuff. It's not worth like breast implant illness being a possibility. It's also not worth feeling lumps in my breast. as a possibility. So all that to say, I decided to just have mine lifted and put back on the shelf, and I'm extremely happy with my decision. They are just what I want them to be, and I don't need all that extra volume. I don't have room and time for all that to carry any extra things around. I've got 3 kids. I don't need something else to carry. And yeah, so that's why I made the decision I did in just having mine lifted. I really want you, if you're considering any kind of breast surgery, to do your research, make the right decision for you. There's no shame in getting implant or having a fat transfer, but just be educated and know going into it, like long term, what this looks like, pros and cons, because I would hate for somebody to have a fat transfer and not know about these things years later, find lumps, be terrified, have a scare of breast cancer. It's just not worth it to me personally, but everybody needs to make their own health decisions. So I hope that this has been very helpful for you. Okay, bye.
That's a wrap on today's episode of What the Gut. I'm so grateful that you're here, and I hope you're walking away with insights that bring you closer to feeling your absolute best. If you loved this episode, it would mean the world to me if you would take a moment to leave a review. It helps more people like you find this podcast and get the answers that they need. And don't forget to hit that subscribe so that you never miss a new episode. Let's keep the conversation going over on Instagram. Find me at Allison Gets Well for daily gut health tips, behind the scenes, and more ways to support your wellness journey. I would also love to hear what topics you want covered in future episodes. If you have a burning question or a guest that you'd love to hear from, shoot me an email at hello@allisongetswell.com. If you're ready for real personalized support on your health journey, until next time, stay curious, nourish your body, and take care of your gut. Catch you soon.